So how far out are you from your surgery?
3 weeks as of yesterday.
And how do you feel today?
I feel good. It's definitely getting a lot easier. I'm sleeping a lot better. I really have no pain at all. I don't even take pain medications. I'm moving around. I'm loving my results. As you can see, I'm still swollen, so not all the swelling has gone down. I'm actually having to wear a waist cincher on top of my compression garment. I don't have one on today just because I need the extra compression because my garment fits around my butt, but it's gotten loose around my abdomen, so it's not giving me the compression I need. So I do wear a waist cincher now to help give me the compression, but I don't have one on today.
Because she snatched y'all.
And ooh. Yeah, but I'm loving it. It was definitely worth it. The first week was rough, second week a little bit better, third week I'm really almost feeling back to normal.
Yay! Okay, we're gonna follow you on your journey, interview you next week, and see how you're doing.
All right.
Okay. Coming from out of town, do you have to stay the whole 2 weeks, or when is a good time to be able to go back home?
So if you're coming from out of town, it just depends on what you're having done. You know, a lot of times we have our patients, if you're getting their butt done, stay 7 to 10 days. If you're getting a tummy tuck with a butt, we want you to stay about 10 to 14 days. Now, of course, if you're coming from out of the country, I usually like you to stay about 3 weeks. If you are fat grafted butt and tummy tuck, then usually I want you to stay about 14 days. You know, but if you're getting like a breast augmentation, you know, I like you, if you're coming from far away, I want you to stay about 7 days. But if you're coming from closer in, like let's say, you know, you're 2 hours away, then sometimes I'll let you leave a little earlier, but it's all case dependent.
What pre-op labs do you need before surgery, and what can stop you from getting surgery?
Okay, so the pre-op process, there's some standard stuff that we get depending on your age. So a lot of times we want to check, make sure that you're not anemic, and make sure your kidneys work well, that you're not diabetic. If you're getting breast done and you're above the age of 40, or if you have a strong family history of breast cancer, then we want you to get a mammogram. If you have any cardiac issues, we want you to get a cardiac clearance. If you have any, whatever issues you have, rheumatologic issues, we want you to get a rheumatologic clearance, etc. If you have diabetes, we want to get a note from your endocrinologist. If you have bleeding disorders, we're going to want you to get a clearance from your hematologist. If you've had previous surgery, cosmetic surgery, especially breast surgery, then we're going to want to get your old OR records. And things that could stop you from having surgery is out of control, like vital signs. For instance, if you have uncontrolled high blood pressure. And then of course, if you have massive weight loss surgery. And so we just want you to optimize yourself before surgery. We take everybody on an individual case-by-case basis. We don't make any sweeping generalized statements about who we're going to operate on and who we're not. Oh yeah, well, I mean, we do want you to be a BMI of about 30 or less before your surgery. So, some people have big legs, so their BMI is going to be a little higher, but in general, we want your BMI to be around 28, 29, something like that. Okay,
and as for the last question, how soon after having a baby can you have surgery?
So usually we like you to be finished breastfeeding for about 3 months. Make sure the baby's situated and has a good support system. You have a good support system in place, because surgery is hard and it's gonna be hard to care for a newborn while you're trying to care for yourself. So in general, we like to wait about 3 months after you stop breastfeeding.
And what if they don't breastfeed?
Then 3 months.
Okay.